This is so embarrassing. I don't even know why I'm here. I'm perfectly fine. I don't even have any. My face is fine. I'm not dizzy. I'm not weak. I'm perfectly fine. We should just go. We should just get out of here.
That was not normal. I don't know exactly what it was, but I really think that we should wait and find out because it seems scary to me.
But I'm okay now. I don't know why. I mean, we should just go.
I know, but they'll run tests. They'll find out what happened. Do you want to test it again?
No.
Okay, so let's find out what it is.
Hi, I'm Kendra. I'm your nurse tonight. Can I get your first and last name?
Nicole Richardson.
And are you a family member, a friend?
I'm the neighbor.
The neighbor. Okay. I'm gonna reach in here and grab some hand sanitizer, ladies. So, I heard you had an event today. I wanted to talk about it. The chart says that it's a TIA. Have you ever heard of that term before?
No.
Oh, okay. Well, I brought a handout and I thought we could talk about it, but I did want to see what kind of symptoms you experienced today, and I heard that you witnessed what had happened today.
Yeah, she was outside and I was out there. Noticed that she was not doing too well. And then she kind of started getting all weak looking. And so I went over to check on her and she just couldn't even hold herself up anymore.
Oh, wow. Okay. And then I also saw on the chart that you noticed that her face was drooping on one side, right?
Yeah, she was having a little trouble with that and her speech was a little different.
Oh, okay. Okay. Did you feel any different?
No, I felt okay, and then until I got weak and my right leg, and so I had to sit down. But
Okay. Yeah, well, what I do is I come in and I talk, to patients and educate them on what's going on with them. And like I said, I brought you a handout, and I was hoping, I know it's scary, it says stroke, but I'd like to explain to you a little bit more about what had happened. And I'll walk through it with you. I have my own copy too, and then if you don't mind, I'll share it with your friend. So if we can flip onto that, it looks like it's page number 2. So go past. There we go. Okay. So this is a picture of the brain, and this is stuff that obviously it's not everyday language, but I'll walk through it with you. Okay. So what had happened in your brain is one of these arteries got blocked, and it was just temporarily. And this last sentence in here says a transient ischemic attack, a TIA, which I mentioned was what you experienced, occurs when the blood supply to the brain is blocked for a short time. And when this happens, the brain temporarily malfunctions. So that's what you experienced, was that brief moment of not having your normal speech. Your friend saw that you were weak on one side. So that was temporary, right? You only experienced it for a few minutes.
right, I'm perfectly fine now. It's
Right.
embarrassing to even be here.
I understand. But there is a cause behind that, and I wanted to talk to you about that too. And it is something that can be treated. So if you go to page number 4, 2 more over. So it shows you a picture of a normal artery that's clear. And then, what it ended up, and then what causes a blockage in an artery is a plaque. It's usually fat lining the artery on the inside. And then what happens is some sort of event knocks it clear, and then it usually in the neck, and it goes up to the brain and stops blood flow for a temporary amount of time. So that's what we call atherosclerosis, and it's something that we can check further into to see if that's what you experienced. Okay, but obviously the clot, if we talk about here in the last paragraph, the clot dissolved because that's why you don't have permanent damage. Okay, and then obviously there's no permanent signs of a stroke. That's why you were recovered within a few minutes. Okay, so this is and the rest of it the next couple pages talk about a traditional stroke, which is not what you experienced. So we're gonna flip through to the TIA, and that's on page 11. So, and you can tell me these were the symptoms you experienced. Was it on page 11? Did you?
Oh.
This has a TIA on it. Nope. You got one more. Oh, did I miss it?
It's missing page 11.
Okay. Well, I'll share mine with you. And it talks about you experiencing numbness, or the weakness, or the change in your vision, or loss of vision, trouble speaking, and loss of balance or coordination. Did you experience all of those?
I guess so, yeah.
Yeah, you did. Okay. That was what your friend had attested to. It's hard when you're the actual patient or the actual person experiencing it to see it from the outside, right?
Mm-hmm.
Okay, so, and then the concern is that I know, is prevention. Obviously, is to not have this happen again. And, one of the biggest concerns about TIAs is within 40% of people who have TIAs within a week experience a full-fledged stroke. Have you ever met anybody who's had a stroke before?
Yeah.
And have you seen some of the permanent damage that can happen?
Yeah.
And there's no promise that it'll be little or a lot. They could be, one whole side of your body can be a little or a lot, and that's the scary part. And so those are some ugly statistics, obviously. So, and it's important to get something treated. I noticed that on your chart you had a blood pressure of 172 over 100, and that you have had hypertension for quite some time.
I have, yeah.
And that it hasn't been treated. Okay, and that's something that we call modifiable risk factors. That's something that you can work with. It's something, there's between diet and exercise and also, eliminating some things from your diet and potentially medications. Now, that would involve you staying for some further treatment, but we'd have to, talk about that with your provider. So I wanted to bring you a handout about blood pressure and just as an educational thing for you to look over, okay? Do you remember the last time you saw a primary care physician and had your cholesterol checked or anything like that?
Well, I was supposed to go about 6 months ago, but I just haven't made it around to going.
Okay, well, those are the things that we would like to check if you stayed for treatment. We would check some blood, would obviously check your cholesterol, and we would check, just your other counts and things like that would determine whether or not you have another risk factor of having another TIA or a stroke. Like your platelets, that's what forming the clot within your blood system. Okay. And then also we would do an MRI or a CAT scan just to make sure that the rest of your arteries are not clogged like the one that potentially caused your TIA today. Okay. And then we would do a physical examination. But, like I said, there are, we feel like statistics show that 80% of these events are preventable with treatment. And so I would like you to consider staying and having at least a doctor talk to you about what I've talked to you about and what we could do to help and prevent this from happening again. I can't keep you here against your will, and nobody else in this hospital can either. So I want to send you home with the pamphlet that I gave you, but I want you to know that you probably need to tell your friends and your family that if they see something like this happening, it's not something to wait around for, that you need to call 911. It is life-threatening. And, in the stroke brochure, we talk about the force FAST is what we call the abbreviations. It's the face. So if we were assessing your face to make sure that it's not drooping, that's a telltale sign. Your arms, raise both your arms over your head. You're going to have your friends and family ask you these questions if they see something that's not going the way it should for you. And then your speech, like your neighbor Cheryl Hedman saw you that you started slurring and something wasn't right, and she knew it. And then also time. Remember, I said we don't want to waste time when you're experiencing these things. So I want to send this home with you, and I hope you'll look it all over. If you choose to stay, like I said, we can prevent possibly these things happening again. Some permanent damage. So.
Well, it sounds pretty serious. So what essentially you're saying is that even though the clot resolved itself today, that had it not have resolved itself, it would have led to a full stroke. And I mean, depending upon the severity of it, I could have died, or it could have had some serious repercussions from it.
Yeah. And so do you understand that hypertension is one of the leading causes? Your uncontrolled hypertension is one of the leading causes to what just happened today?
Yeah.
Okay. And then also you understand that you need to notify your family and your friends about the warning signs of potentially what could happen.
Right.
To recognize those 4 things.
So it was fast. So face, arms, speech, and time.
Time.
Yeah, emergency.
Absolutely. All right. And then I would hope you understand your need for further assessment, because obviously preventative measures are the only way to prevent this from happening.
Yeah, I mean it's it's embarrassing to be here, but also to have uncontrollable hypertension. I just, you know, I mean, I know I've been ignoring my health, but I guess it's important for me to make sure that there's nothing else that could potentially cause further, you know, another TIA or a stroke, so.
The goal being to prevent permanent damage.
Right.
Okay. Well, thanks for listening to me. I really hope you consider to stay and let the provider talk to you. Okay. And
Alright.
thanks for being a supportive friend.
I'm always there for her.
Yes, she is.
All right. Well, thank you, ladies. It was nice to meet you.
Thank you, Kendra.